welcome back to our COVID-19 Community Connector series. Last time we discussed the structure of how education is going to look for our students. Today we will be discussing employment. Employment has definitely been harder for us to find in the last couple of months. But knowing your right as an employee is incredibly important, especially during this pandemic. Knowing your rights as a refugee employer is also very important, as things may be lost in translation. Here are some ways to help you get right from the CDC. If you or someone in your household has an increased risk of severe illness, you will need to take extra precautions. Check with your employer to see if there are policies and practices in place to reduce your risk at work, like telework or modified job responsibilities. If you are having any issues or troubles with speaking to someone from HR, please contact Bethany's employment team. Please make sure for your safety and the safety of others to stay home when needed. Your right as an employer is as follows under the Families First Coronavirus Response Act. Certain public employers and private employers with fewer than 500 employees are required to provide 80 hours of sick paid leave for positive COVID-19 cases. Here's some additional info about what an employee would be eligible for under this act. 2 weeks up to 80 hours of paid sick leave at the employee's regular rate of pay, where the employee is unable to work because of the employee is quarantined following federal, state, or local government order or advice of a healthcare provider, and or experiencing COVID-19 symptoms and seeking a medical diagnosis, or 2 weeks up to 80 hours of paid sick leave at 2/3 the employee's regular rate of pay, because the employee is unable to work because of the real need to care for an individual subject to quarantine following federal, state, or local government order or advice of a healthcare provider, or to care for a child under 18 years of age, whose school or childcare provider is closed or unavailable for reasons related to COVID-19, and or the employee is experiencing a substantially similar condition as specified by the Secretary of Health and Human Services, in discussion with the Secretaries of the Treasury and Labor, and up to an additional 10 weeks of paid expanded family and medical leave at 2/3 the regular employee's rate of pay, where an employee who has been employed for at least 30 calendar days is unable to work due to a real need for leave to care for a child whose school or child care provider is closed or unavailable for reasons related to COVID-19. If you have or think you have symptoms or have tested positive for COVID-19, stay home and find out what to do if you are sick, and find out when you can be around others. If you are feeling well but have a family member who may be sick or recently close contact with someone with COVID-19, notify your supervisor and follow all CDC recommended precautions. Follow the rules. Wear a mask, social distance in shared spaces, wash your hands often, cover your coughs and sneezes, avoid sharing objects and equipments, clean and disinfect frequently touched surfaces and objects, and monitor your health for COVID symptoms, including but not limited to fever or chills, cough, shortness of breath or difficulty breathing, fatigue, muscle or body aches, headache, new loss of taste or smell, sore throat, congestion or runny nose, vomiting or diarrhea. If you have any questions, please reach out to the employment team at Bethany. Have a wonderful day, and we look forward to seeing you next time. Thank you.